To speed on the latest on the Wuhan virus. Now, India's COVID-19 tally has shot up to nearly 37 lakh after almost 70,000 cases were recorded in the past 24 hours. Monday was the first time the country registered less than 70,000 cases in the past week. The number of deaths due to COVID-19 are now past the 65,000 mark after over 800 fatalities were recorded over the last 24 hours. The silver lining continues to be recoveries. Over 65,000 people recovered in the last 24 hours, taking the total recoveries to over 28 lakh. Now to some other news where Tamil Nadu is threatening to spiral out of control again. It was under 6,000 cases a day for several weeks, but the count has now begun to slowly mount. The southern state has just announced a raft of measures loosening the entire lockdown, and the worry is whether a hard-fought victory in containment may be squandered away in these relaxations.
Chennai's malls are ready to welcome customers after a gap of over 5 months. The hallways are dusted, parking lots prepped, storefronts open for business again, all with safety procedures in place.
As and when you will enter the mall, after showing the status on your Arogya Setu app as well as sanitizing your feet on the sanitizations mat, you will enter. The thermal cameras will be checking your body temperature, will be recording your body temperature, which will be displayed on the screen. You will be asked to put your baggage to the UV scanner, which is attached to the baggage scanner, and it further disinfects your bag.
Places of worship, clubs, hotels, playgrounds and parks are also reopening. Bus services resume operations for the first time since the March lockdown. Metro rail services a week later. And e-passes for inter-district travel are no longer needed. With relaxations come the fear of infection, so the State Health Department is taking preemptive measures.
Now that the various workplaces and other public areas are getting opened up, there again everybody has to strictly follow the standard operating procedures which have been released both by the Government of India and of course with suitable corrections by the modifications, local requirement by the state. We are also we are coming up with amendments to the Public Health Act, and Public Health Act 1939, empowering people to make this a compoundable offence.
The administration is putting much of the onus of containing the infection on people.
Everybody was feeling that, after 5 months, now that we have built up our infrastructure and we have got testing, we need to open up. That's again a very genuine kind of thing, unlock and correspondingly with the state level changes we have made and all. Public needs to understand that this freedom and this flexibility has to be done with those protection. See, the other challenge for Tamil Nadu is also bringing down the case fatality, even though we are at 1.7. But 1.7% is a number. So to bring that down, we are again seeing that despite such good facilities, people are coming late, despite 80,000 being tested. So those messages, in a remote chance that you get this infection or you feel you should immediately get tested.
As Tamil Nadu opens for business, it's also stepping up testing and contact tracing aggressively. Besides Chennai, several other districts like Cuddalore and Coimbatore are under the scanner. The challenge is to ensure that reopening of the state economy does not lead to a surge in cases. With Purnima Murli in Chennai, Deepika Kora, CNN News 18.